Well, it is estimated that about 80% of all adults are going to experience some sort of back or neck pain in their lifetime. While non-invasive treatments can ease the discomfort for a lot of us, for others, the agony just never seems to end. In our HealthCast today, we're looking at how some new approaches to surgery are improving the chances of real relief.
Ready? Okay, you can take it with you. It's fine.
The simple act of picking up his baby boy was once an impossibility for Lucas de Castro. Months before his son Otis was born, Lucas was suddenly hit with debilitating back pain that seemingly came out of nowhere.
One day I woke up with severe pain, like astronomical pain, went to urgent care. They gave me 2 shots and I thought that was it. And then it just came back and just getting worse and worse and worse to the point where I basically lived off the floor.
When physical therapy failed to help, Lucas ultimately found his way to spine surgeon Dr. Brusovanik. The doctor goes beyond imaging to help pinpoint the source of the problem.
Essentially, if you take a drop of lidocaine, which is a numbing medication, and then you inject that right behind the disc that you think is causing one's pain. If indeed that disc is causing one's pain, that moment, the moment the medication hits the back of the disc, the pain will be gone.
While the pain will return as the anesthetic does wear off, the doctor says the process eliminates any uncertainty, which in turn reduces the risk of needing to repeat a procedure.
So I never have concerns going to surgery that patient will wake up with the same pain, because I definitely insist that even patients who've already had injections, that they try just one more. And that verification then lets me sleep well at night before surgery.
Once the problem area was properly pinpointed, Lucas underwent surgery and experienced immediate relief.
It was night and day. So one day, excruciating pain. The next day, no pain. One day I can't walk. The next day I can walk again. I'm glad that I chose it because I'm able to live my life again. Here's it.
And what a cute little son he has. All right, well, many patients do experience improved mobility and function within weeks of surgery. Full recovery can take several months, even up to a year.